governor says all of the numbers indicate that now is the right time to start reopening Tennessee's economy. But do those numbers add up? As Tennessee tries to find its way through the rebound, News Channel 5 chief investigative reporter Phil Williams is checking the facts. Phil.
No one disputes the idea that Tennesseans are ready to leave their homes and get on with their lives. The question is how and when. After 2 days of street protests over Tennessee's stay-at-home order, Governor Bill Lee made it official. He was finished.
While we continue to emphasize social distancing for Tennesseans, I will not extend the safer at home order past April 30th.
Some saw a decision seemingly driven more by politics than science. One of them, the Franklin pulmonologist who had helped to push Lee into issuing the order.
If you are able to do this right, then the state could potentially get an A. But again, if you do these things wrong, then we're really going to have a significant problem a month from now.
We need some more confirmation of those numbers in the right direction. They haven't been turned downward.
One of the areas being closely watched, a metric touted by the White House, is the number of new cases over a 2-week period. We ran the numbers for the past 14 days, and they don't reflect what many experts would like to see.
So what you want to see is not what we have in Tennessee, where you have 300 plus cases one day, 200 the next day, back to 300 the next day. So you have this sawtooth pattern. What you want to see is a decline in those new cases over a 2-week time period.
On Monday, Lee's health commissioner boasted about another number.
Is for the first time, the number of recovered cases exceeds the number of active cases. Essentially, that means there are more people that have gotten over the disease that are now getting infected. That's very encouraging.
That's encouraging, we discovered, because at the time she was not counting people who had died. Out of 7,238 positive test results, less than half had recovered. Add together the active cases and the number of deaths, and Tennessee was still in the negative.
While there are counties that can probably open up in the state of Tennessee based on a low incidence of COVID-19 and the number of tests they have done, there are also counties where the hospitals are quite busy.
A report last week from Vanderbilt showed the virus was still spreading faster in southern Middle Tennessee than any other part of the state. That's why medical experts caution you cannot leave the decision up to people in the streets.
For some people, survival is getting back to work and being able to put food on the table. Do you understand that?
Absolutely. I certainly understand the need to reopen the economy and to reopen the state, and I support that entirely. But what I also would say is that I support doing it right and being judiciously and following science and not politics.
Dr. Millstone says how this turns out depends upon how well the state enforces the social distancing that will be required when Tennessee reopens its economy. Phil Williams, News Channel 5 investigates.